Hello everyone. Today you will see all symptoms of scarlet fever. Scarlet fever is an acute enteropenotic infection with an aerosol transmission mechanism of the pathogen, which is characterized by an acute onset, fever, intoxication, tonsillitis, and punctate rash. The causative agent is hemolytic Streptococcus gruppusii. The reservoir and source of infection is a patient with tonsillitis, scarlet fever, and other clinical forms of respiratory streptococcal infection, as well as healthy carriers of Grupus streptococci. The patient is most dangerous to others until the third week of illness. Transmission mechanisms: aerosol airborne droplets and contact food and contact household. Infection occurs through close contact with a patient or a carrier for a long time. The incidence of scarlet fever has a pronounced autumn-winter-spring seasonality. Clinical picture: the incubation period is 1-10, usually 2- for days. Scarlet fever is classified according to the type and severity of the cause. Scarlet fever is considered typical, occurring with a feverish intoxication syndrome, tonsillitis, and a rash. Atypical include erased, extrapharyngeal burn, wound, postpartum, as well as the most severe forms hemorrhagic and hypotoxic. According to severity, mild, moderate, and severe forms are distinguished. Main symptoms of scarlet fever. From the very beginning, patients complain of sore throat when swallowing, flaming pharynx on examination. There is a bright diffuse hyperemia of the tonsils, arches, uvula, soft palate, and posterior pharyngeal wall. The tongue is covered with a grayish-white coating, and by the 4-5th day of the disease it is cleared, acquires a bright red color with a crimson tint, raspberry tongue. Papillae of the tongue are hypertrophied. Scarlatinal exanthema against the background of hyperemia of the skin occurs on the 1st-2nd day of the disease. Rash is an important diagnostic sign of the disease. Initially, punctate elements appear on the skin of the face, neck, and upper body. Then the rash quickly passes to the flexor surfaces of the limbs, the sides of the chest and abdomen, and the inner surfaces of the thighs.
In many cases, white dimorphism is clearly expressed.
Pasteur symptom. An important sign of scarlet fever is a thickening of the rash in the form of dark red stripes in places of natural folds, for example, in the elbows, inguinal, and axillary areas. Sometimes abundant confluent small punctate elements are found, which creates a picture of continuous erythema. Flylatov symptom. On the face, the rash is located on bright hyperemic cheeks, to a lesser extent on the forehead and temples, while the nasolabial triangle is free from elements of the rash and is pale. Symptom of shagreen skin. Along with the typical scarlet fever rash, small vesicles and maculopapular elements can be noted. The rash may appear late, only on the 3-4th day of illness, or be absent. Healing of the skin. By the 3rd-5th day, the patient's state of health improves. The temperature begins to gradually decrease. The rash turns pale, gradually disappears, and by the end of the 1st-2nd week is replaced by finely scaly peeling of the skin.
Thanks for watching.